Mariah Carey revealing to People magazine that she was diagnosed with bipolar disorder in 2001. Joining me now to discuss is licensed psychotherapist Erin Foster, and we thank her for bringing this to the conversation and perhaps even the dinner tables of some families and some households. Can you talk about the diagnosis, first of all? Is it something that's difficult to diagnose?
Here's the tricky thing about bipolar. The symptoms really mimic other mental disorders, which makes it really tricky to try and identify what exactly is going on. So right there is an issue for the therapist or the doctor or
and the mental health community, sure.
And the mental health community.
So then within that, she made a point of saying that she's in therapy and taking medication for bipolar 2 disorder. Explain that to us.
All right, so bipolar also works on a spectrum.
Sure.
You have the full-blown bipolar, which is characterized by what I think most of society thinks is the crazy people. It's not. It's these extreme highs and these extreme lows. Then you have bipolar 2, which is depressive moods. However, there's then a swing into what's called hypomania.
How does that manifest?
Hypomania is very hard to differentiate because it's this sort of elevated, but it's not manic. Traditional regular bipolar 1 is characterized by manic, sometimes even psychotic. Hypomanic means I'm just sort of elevated, maybe a little hyper.
So maybe like you've been extra caffeinated.
Maybe a little too much coffee.
Yeah. She's in therapy. She sounds like she's got the right team on her side. And I know there's medication available. Okay. It doesn't have to be a terrible sentence to someone to be diagnosed.
I have treated so many people with bipolar where I say, this is fantastic news, and here's why. We can manage this.
Yeah.
Medication is really just evening out the chemistry.
Sure.
Psychotherapy is really just increasing your awareness, adding to your tools of how do I manage when I feel something coming up? How do I choose to put in a different, more healthy behavior?
Yeah. The fact that she's doing this is going to help countless people that are in their own battles, and you don't have to be in that battle alone.
You don't have to suffer. There's no reason to suffer with bipolar because there are so many tools, support, therapies, behavior modification.
Reach out to your family physician. First step, if you think that there might be an issue.
First step, if you are really concerned, you can go to a psychiatrist.
Okay.
And then you want to layer in family support, perhaps family therapy, and then of course psychotherapy.
All right. Erin Foster, thank you so much. Appreciate it.